Health officials say they've seen a 937% increase in reported cases over the past decade. However, the CDC found in 2022 that other sexually transmitted infections like chlamydia and gonorrhea were not following that same trend. So to understand what's behind all of this, Dr. Ina Park is joining us. She is a professor at the University of California, San Francisco School of Medicine. She's also the medical director for the California Prevention Training Center and serves as a medical consultant to the CDC's Division of STD Prevention. All right, Dr. Park, talk to us about what is driving the spike in syphilis, but not in other STIs. And feel free to be as graphic as necessary. This is educational.
Well, it's funny because we were just talking about Mardi Gras. And so after Mardi Gras, more syphilis. But part of the issue is that during the pandemic, there's infections like chlamydia and gonorrhea, which in women often don't have symptoms. And during the pandemic, we simply stopped screening for those infections because a lot of clinics just had to shut their doors for a while. And I really don't think that we've caught up. But in the meantime, syphilis, which actually has much lower numbers overall than an infection like chlamydia, which has almost 2 million infections, across the country, an infection like syphilis is actually much more tightly linked to certain sexual networks and then other issues like poverty, incarceration, and substance use. So in terms of the populations it's affecting, it's a little bit different than your garden variety chlamydia, for example.
So maybe it's lack of testing first because people don't have symptoms, but then chlamydia, gonorrhea might still be up. It's just that the monitoring for syphilis is, we're seeing those spikes.
Well, we're seeing, syphilis also can be asymptomatic, but I think a lot of people aren't coming in and getting their routine screening, we think, possibly for chlamydia and gonorrhea. So that might be why those cases are down. But they also may reflect real declines. But we certainly see that because of issues with poverty and lack of access to care and incarceration and substance use, that syphilis is going up.
I see. So who's being hardest hit by this rise in syphilis? And why?
Well, when we look at the absolute number of cases in the U.S., white Americans have the most number of cases. But when we look at the rates in a population of 100,000 people, for example, it's American Indian and Alaska Native populations, so indigenous communities, as well as African Americans. And finally, we have Pacific Islanders also strongly affected. And then you may have mentioned we did see a huge spike, as you saw, but a huge amount of that spike has been in women and infants. And so, unfortunately, we've had almost a 100% increase in syphilis in newborn babies in the past 5 years.
Wow, that's super concerning. Talk about how to prevent it. Of course, I'm sure, encouraging people to get tested. What kind of treatments? What does that look like?
Yeah, I really think, the CDC has issued some guidelines and every state is doing it a little bit differently. But I'm going to say anybody, who's capable of getting pregnant should be screened for syphilis probably at least once a year. And for folks who are having more sex and more frequent partners, you can check as often as every 3 months. And then, and because this infection can often not have symptoms, you do have to get a blood test to know whether or not you're infected with syphilis. But treatment is easy and it's cheap. It's actually just a shot of penicillin for most people. And so, I strongly recommend that people go out there and get tested. That's our best defense and getting treated early.
Dr. Ina Park, thank you so much for that.